Welcome back as you guys to my channel of an everyday life of an Aspie. If you're new to my channel, I welcome you all. I'm Aspie. I'm all about creating mental health and awareness versus sharing my life story, taking you on a journey with mine, with Asperger's syndrome, OCD and the like, along with some tips and advice with your mental health and general health in particular, as well as also just some bits and pieces of words and encouragement here and there for words of wisdom or a bit of encouragement just to lighten your day regardless what it may be. So it's been brought to my attention, as I said before, that I'm trying to quickly do some more autism in series if you've been following me on my Facebook, because obviously they're coming out of late due to me personal reasons of late to why I've done this or decided to do this. So I have to apologise to the ones that maybe are requiring more autism and series of whatever topic that I may bring. So enough with the do, guys. Before I lose track of time, I'm doing a disclaimer as always. I'm not a medical doctor, I'm just your normal everyday Joe vlogs. So if you see anything out of the ordinary, seek professional help for yourself or your loved one, or especially maybe medical opinion or advice through yourself or your loved one. So let's begin this. As we know, I was just talking briefly about autism spectrum and pet therapy, or what have you, part 1. This one's again another one of the pet therapy session, so hopefully you guys will engage in this and hopefully will know what I'm talking about. As we know, basically when it comes down to pet therapy, it's not just always for people that are autistic and that can benefit from this. It can be a lot of people with high specialized needs versus just your normal neurotypicals, to reduce your stress levels, provide companionship, to provide basically comfort, peace, pretty much of certain animals that you may have on. If you can't, talk to people, it can help you with communication skills versus socialization skills. It has been clearly shown, obviously, for most research here in the past and present. However, as we know though, however, individuals with ASD will often suffer from difficulty in focusing, responding to sensory stimuli and communicating with others, but this is not always the case for people with ASD, or will vary from person to person, just to me and mine. All of which though has been shown to improve after use of pet therapy. Of what I clearly shared, that the increase of focus is on the rise. The response to sensory stimuli is obviously increased, as well as just the communicating with others as well. A variety of studies has supported the concept that animals can be particularly effective for children who have ASD. A classic example of it all, research has shown that all such children tend to prefer pictures of animals to those of humans and are least responsive to the sound of the human voice as opposed to any other stimuli around them. According to a study by Barry et al., has introduced a dog to a child or children with ASD can then result in a reduction of stress, anxiety and irritation, and can also promote a more relaxed environment for those children with ASD, as I shared before clearly earlier in the piece. These such findings were most likely the trigger for the most part for the first investigations on use of pet therapy for individuals with ASD. There were, however, some trials that were evaluated in a systematic review by OHED on animal-assisted therapy when used for treatment of ASD. In that review, however, it was reported that the most commonly used animals for therapies were dogs and horses, although indicating further research was required to determine which species of animals were effective, or the most effective. However, the review has found no significant differences between the uses of dogs and horses. However, all of the studies in that review showed improvements in one or more categories related to the ASD and the symptoms that persist in people with ASD. A study by Ward et al. Investigated the social and sensory benefits that therapeutic horseback riding could have on children with ASD. The study showed positive effects on participants' abilities to communicate and also a reduction in the severity of their ASD as measured by the Autism Index, which mean equals 100, standard deviation equals 15. Moreover, the most positive effect of the riding program wasn't only observed in the therapeutic setting, but also by the children's teachers in a classroom setting, as found in progress reports from these teachers for the participants. Graduate et.al. suggested that introduction of a therapy dog could be particularly effective for improving pro-social behaviours in children with ASD. This study, however, has recorded data from a control group of families that had never owned a dog in their life and an intervention group of families that had owned a dog. Since the birth of their child with ASD. Interestingly enough, the researchers found that pro-social behaviour between those families that had never owned a dog and those that had always owned a dog was approximately the same results. Meanwhile, the group in which a dog was newly introduced to a family showed a significant improvement in pro-social behaviours. The researchers also performed a comparison of assessments of the children by parents versus those of trained professionals and reported that the listed improvements were nearly the same. Most of the past studies, however, that was investigated by using the use of pet therapy for ASD focused on psychosocial aspects of ASD, but not the psychological factors. In research that was trialled by Wu et al., however, the researchers tackled the physiological factors by quantifying the effects of pet therapy on cortisol stimulation, or secretion, shall I say. The cortisol level they primarily measured was the cortisol awakening response, or the CAR, a marker which is obviously of the life stresses. After the introduction of a dog into families, parents stated that the problematic behaviours from their children subsequently decreased. Also, a significant 48% decrease in CAR levels was observed among the children with ASD. Moreover, this large decrease didn't occur as a spike in the initial weeks of these studies, however, but rather as a gradual decrease that accumulated within time, like anything within studies or research findings. This finding of a gradual decrease in the CAR, or the cortisol awakening response, just bear in mind why I'm abbreviating, suggested that the change was most likely to have occurred as a result of the presence of a dog. Ward et al. Have proposed that searching for further answers in the field of pet therapy for ASD is justifiable. According to Berry et al., future research involving pet therapy in practice would be particularly invaluable because of the multiple positive effects listed previously to what I mentioned on these participants, as well as on their family members. For instance, those researchers concluded the use of assistance in therapy dogs can reduce the severity of ASD as mentioned. The study was significant not only because it provided further evidence that pet therapy can improve quality of life for those with ASD, but also because it found that therapy dogs can promote the comfort and happiness of the whole family unit by facilitating interactions. Those findings were gathered from questionnaires completed by parents during and after the studies were conducted. That study wasn't the only one that found a high level of satisfaction for all family members involved in pet therapy, however, for ASD. In a prospective trial conducted by Kearney et al. On the use of equine therapy for ASD, similar feedback was received from the study's participants. During and after that study, however, a high level of satisfaction and an increase in quality of life were reported by both children with ASD and their parents. Even in a less traditional form of animal-assisted therapy for ASD that involved patients' interactions with dolphins, families participating in the study noted that the experience was highly enjoyable and that the therapy has a positive effect on their children. Speculation has occurred that the inconveniences may outweigh the benefits of pet therapy, for example, when pet therapy entails integrating a dog into a family. In a qualitative study by Burrows and Adams, the difficulties were quantified regarding the issues that families face when they took on therapy dog for the treatment of their children with autism. The families noticed some inconveniences that accompanied this form of therapy, but the overwhelming finding was that the families were highly satisfied despite any stress that having the dog had added, and that they believed that the benefits largely outweighed the inconveniences. So as you can see, basically, before I end this, for any type of animal that's introduced in the family, cat, dog, whatever, it can be beneficial for the ones, especially with autism spectrum disorders or autism or what have you, because obviously, as they say, the negatives are not outweighed by the positives, but vice versa, positives are outweighing the negatives on how it will actually work for the child and the family that's involved. So this quickly ends briefly Autism and Pet Therapy Part 2. Give me the like for thumbs up support, comment below. Also feel free to comment below if you're one of the many that may have some pets and how you feel about it. You know, do you find comfort in all that? And you know, maybe either Twitter me on my social media sites showing me your pets and what you have as a form of comfort and whatnot. Feel free to turn on the notification bell so you're ready to know what's going on with me. Feel free to actually subscribe to the channel if you haven't done so, if you want to get to know me more as a person, so that we can get together as a group and hopefully, you know, interact with one another. Feel free to share these videos around to family and friends. And all for today, guys, thanks for the support, thanks for watching. Do what you love what you do. Until next time, Aspie signing out, and I'll see you again soon. Ciao for now. Autism and Pet Therapy.